welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and here are the latest reports for today. Vitamin D levels during pregnancy may be linked to even postpartum depression, a study reveals. Postpartum depression, a prevalent mood disorder, is estimated to affect around 20 to 40% of women worldwide after childbirth. Recent studies in the Journal of Pharmacy Technology have investigated the effect of vitamin D on the prevention of depression and mood disorders, but it still remains unclear how vitamin D may affect the postpartum depression. Results from meta-analysis have suggested a possible association between the two parameters, and the studies found a significant correlation between patients with low vitamin D levels as well as postpartum depression. But the third study found that high vitamin D levels are associated with a greater incidence of postpartum depression. Now, considering this fact, women at high risk of postpartum depression should be made aware of this potential association and the ways to maintain even normal vitamin D levels. Fish oil and DASH diet partially alter the lipid metabolism, not glycemic control or even adiposity. Type 2 diabetes is associated with elevated levels of metabolic abnormalities and systemic inflammation, with an increased risk of developing cardiovascular diseases. A recent study suggests that fish oil intervention with a dietary approach to stop hypertension, which is the DASH diet, had partial alteration on the lipid metabolism and inflammatory mediators. The study findings were presented at the Metabolic Institute of America 2021 World Congress Insulin Resistance, Diabetes and Cardiovascular Disease meeting. In type 2 diabetes patients, the nutritional therapy of omega-3 fatty acid supplements may be further investigated via lipidemics and genomics analysis on both type 1 as well as type 2 diabetes patients. Brain lesions on MRI linked to years of playing football. We all love to play football or probably even see football. White matter hyperintensities are areas that appear bright on MRI scans. They are common in people as they age and with medical conditions like even high blood pressure. A research is published in the online issue of Neurology, the Medical Journal of American Academy of Neurology, that finds that brain scans taken during the lifetime of athletes in contact sports compared to changes in the brains of autopsy showed that white matter hyperintensities were associated with neuropathological changes. The study also found that white matter hyperintensities were more common in athletes who played contact sports longer or even had head impacts during their careers. Long-term exposure to air pollution linked to fatty liver disease. Metabolic-associated fatty liver disease is a growing global health challenge and poses a substantial economic burden. A large-scale epidemiologic study has identified links between long-term exposure to ambient air pollution as well as metabolic-associated fatty liver disease. Researchers found that long-term exposure to ambient air pollution may increase the odds of developing this condition, especially in individuals who are males, smokers, and even alcohol drinkers for that matter, and those who consume a very high-fat diet. Unhealthy lifestyle behaviors and an excess accumulation of fat in the abdominal area may exacerbate these harmful effects. Spaceflight leads to brow elevation without affecting the eyelid position. A recent study revealed that spaceflight, although does not consistently alter the upper eyelid position, it does lead to a significant elevation of the brow position. In simpler words, gravity has a more pronounced effect on brow position than it does the eyelid position. The study appears in the Journal of Ophthalmic Plastic and Reconstructive Surgery. While spaceflight led to a significant elevation of pupil to brow, it did not consequently alter the measurements from the center of the pupil to the upper eyelid margin. As such, the brow and the eyelid appear to be independently regulated with respect to gravitational changes. That's all for today. I shall see you tomorrow.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.